Oh,
Hello, everyone. It's still Nursing 204 with Karen and Deb.
mostly Deb.
No, it's Karen and Deb. So with this video, we're going to talk about the Wound Vac, which they're very cool. I don't know if any of you have ever had the experience or the exposure with Wound Vacs, but they are amazing. My dear father had a fall and had a pretty significant wound to his knee. And within 1 month, his knee, which had become a very deep wound with tunneling and everything, and within 1 month, most of that wound had closed up. So I became a firm believer just by watching all that went on with my father's wound. But anyhow, we are going to use Jane's Heine one more time. So when using the Wound Vac with big wounds, there's a fair amount of healing that needs to take place before you can start using the Wound Vac. Usually the Wound Vac helps with closing in big wounds, but they have granulated from the bottom up, and so they're filling in. Otherwise, it kind of becomes a bottomless hole that you're trying to use a Wound Vac for. And really, it's more for when a wound is getting closer to the end of the healing stage. So what you will need, I have clean gloves. This is considered a clean technique. It is initially done sterilely in surgery because usually there's been some sort of surgical debridement or something like that, where they've removed some of the old dead tissues, kind of tried to help to, sometimes they'll even kind of scrape the wound a little bit just to kind of encourage new tissue growth and all. But anyhow, once the patient is no longer in surgery, this technique is considered clean. So I know that with wound care, we said sterile, and that's because the wound is so much deeper. And usually there's tunneling involved, and you do want to keep that sterile. This at this point is considered a clean technique. So there are kits that are wound care kits that come. So you will need one of those. You will also need, this is the set that goes into it's kind of a suction machine. And then you'll also need the suction machine. I'm very sorry. We don't have one of those so that you can see what that looks like, but you'll just have to believe us that there is a suction machine. And it's a box that's probably 8 inches or so by about 6 inches. It's pretty mobile. It can go with you wherever you go. So anyhow.
We only have the cassette.
Yep, we only have the cassette. Exactly. So you'll open up your packet. I also have a pair of sterile scissors. Yes, these are very sterile. We blew on them. I also grabbed some non-sting skin prep to put on the skin. Once again, you do want to protect the outer skin that is intact. You want to make certain that it's doing okay with all the adhesive and everything. So in your Wound Vac kit, oh, the green dot. Yep, that'd be the green dot. Go for the green dot. There is this sponge. As you can see, it's about a half an inch wide or so. And I don't know if you can see with this green dot. I have to go for the green dot. It's kind of, it's cut and it goes in a spiral. And so it comes apart. Thank you, hon. It comes apart. You can open this up and cut it wherever you need to. It is, it's the sponge piece that is the part that goes into the wound. And because Jane's Heine wound is so large, mostly this will fit within the area. Now you want it to go just inside the skin area there. We have this little piece right here that overlaps. So with my sterile scissors, I am going to cut this part. Thank you. And then we are going to cut. Let's see here. I had a plan, but I don't know that my first plan is my best plan. So let's cut it like this. Okay. So you want it to just fit inside the wound area there. Then you are going to want to put the skin prep around. So use the skin prep on the skin. As you can see with Jane's hiney here, it's very important to have 2 people to help with holding. Because the area is so large, I would recommend using this whole piece of plastic.
But still not covering the vent hole. The exit hole.
The exit hole, yes, exactly. So you can start to pull part of this back, and I'm going to want to start, oops, we'll start.
So that's 2. Where's 1? 1's on the other side.
Is on the, oh.
Yeah, that's 2. There we go.
Okay.
This is 1.
Oh, thank you.
No, did I already blow it?
I think can we do half and half?
Sorry.
We're going to take it all off.
Oh, sorry. My bad.
No.
My bad.
It's okay. It's okay.
And then you want to put it over? Holding it like
I was going to start it on one side. Go ahead and expose. It's written 1 and 2. Oh, okay.
We got another piece. We can mess up with the other piece.
Okay. So you'll want to adhere this to her skin, to Jane's skin.
Making sure there's no wrinkles.
Yes, making sure there is no wrinkles.
Which is hard because you've got
It
corners.
is hard.
You want to pick it up and
Scooch it over a little more. Whoop. My little piece over here. It wants to go. Okay.
Sorry, my bad.
No, you're fine. You're good. We got it. There we go. Let's try that.
But if you do get wrinkles, there is a remedy.
Yes. And because we have curves on our bodies, it's pretty hard not to have wrinkles.
Especially if you're made of hard plastic.
That's right. Thank goodness human bodies are a little more forgiving. So you have to.
Yeah.
We could cut it and then overlap it.
Yeah.
Oh, you want to?
On this side to see if I can get it to go down.
Okay.
Because with the hard edge, it wasn't going.
So we did, it says number 2, which is what we're doing. We're pulling this part off and we're getting this all smoothed out.
Obviously going to have to use some patching.
Yes. Then when you have that part secured, oops, we have a little, we have a little bare spot here. All good, all good. Okay.
All kinds of bare spots. Let's see. So we've got this bare spot here, so we could take this and this bare spot here.
Okay. Yeah, it didn't quite secure down. You want to make certain that the offsite is definitely covering. I think we can do this one. We got this.
I don't think so. I think I stuck it to itself.
It just wants to be obstinate. Okay, here we go. So you want to definitely make certain that there is offside all the way around so that you are able to create a seal. That is what is totally important. That is the goal with the Wound Vac, is to create a seal. So you should be able to tear off. Is this not there? Oh, it's on there. Okay. Excuse me, I was trying to do it the hard way because why not? It's more fun when you make it hard, right? Yeah, no. So once again, yep. Yeah. There we go. Oop. Once again, watch out for Jane's hiney hole and get that secured. Go ahead.
Control.
Okay, there we go. As you can see, it's more fun with friends to do this. And then go ahead and pull off step 2.
Making sure you're sealed against
Yep.
skin everywhere.
Everywhere. And that non-sting skin prep will really help to do that. So it kind of looks like it's all under saran wrap. That's exactly what we want to see. Now then, this is a really cool part. You will use your sterile scissors, of course. In the center of the wound, you want to take your scissors and make a little cut. And what this does is it opens up a spot, and we'll show you. It opens up a spot where the suction piece is going to fit in there. And you want to make certain that it's big enough that the suction has a good work area there. Okay. Now then, step 1, take this part off. There you go. So this hole goes over the hole that you have cut out. And then, is that also I think it's this. You want to take off part 2 of the paper. Now then, that didn't, oh, there you go. Thank you. It is coming off. Good. Excellent. So you make certain that that is all removed. And now then what you want to do is put strips of offsite around to create the final seal of this going up against the patient's skin. Or up against the, create a seal to hold it up against the foam. Excuse me.
Do you want half pieces or whole pieces?
I think half pieces.
We'll give it a shot.
Yeah, absolutely. Thank you.
This is a very complicated wound.
It is a complicated wound, and usually, well, I won't say usually you aren't going to get this complicated. However, we have seen some pretty involved ones, that's for sure. Okay, where did I go wrong? Oh, yeah, there it is. Sometimes it's hard to find your ends. That's for sure. There we go. Good job. Excellent. Pull that. Oh. Yeah. Okay.
Oh, I see. It's a little tricky.
It is tricky. But I think there we go. Okay. I guess it's there. We did such a good job. It's hard to see. One more to go.
We'll see if we did a good job or if we need more patches.
Absolutely.
It's almost like patching a tire.
Yeah, good point. So now then you would hook this up into, there's a little cap on the end here. And these little guys that you'll see, there are some little
Protrusions.
Yeah, little points that come out, but it fits right inside here, and then it slides and click locks. This would be clamped until you have it into the suction machine, and then once you have it in the suction machine, you can open that. But what we're going to see now, I'm going to just check and see if this will compress.
But this isn't what you would do. Oh, look at that. It compressed all the way down. See that? So we got good suction. Don't do this at home or to your patients.
Or to your patient. We strongly advise that you not suck on the end of this, of your patient's wound vac device. Absolutely. So I'll try and put these green dot. You can see that there are little connections there, and there's little little track areas there that these little points will go into. The whatchamajiggies and the thingamabobs. So it goes like that. And then this goes into the machine, and you turn on the machine. So that is how you do a wound vac, and like we said, it's more fun with friends.
Yeah.
And now Karen is going to talk about the nutrition part. So
also,
thank you.
It always comes with the extra sheets in case you have to patch like we just did. So there's always these little sheets that you can use. You have to remember to follow the number 1 and then the number 2. If you do it backwards, it won't work well for you.
And you'll have a big gob of opsite stuck to your gloves and in a ball.
So, you grab me a pen over there.
Of course.
Let's talk a little bit about nutrition. So when you see that serosang, that fluid that comes out of that wound that you're tracking, you're documenting is heavily saturated with serosang. On a wound like this, if you took that wound dressing out and it's heavily saturated with serosang, what's leaking? What's the stuff that's leaking out of there? That's going to be proteins, and those proteins are called what? Starts with an A. Does anybody know? Louder. Yes.
Albumin.
Albumin. It is albumin. Correct. Good answer.
Thank you.
So albumin is a very large protein as far as vascularity goes. When we're talking about vessels, those large proteins are what pull the water into our vessels. That's caused you remember osmosis, where osmosis is the movement of water through a semi-permeable membrane, which would be what? Your capillaries. It would be that movement of water from lesser concentration of solute to a higher concentration of solute. Solute would be albumin. It would be the red blood cells, white blood cells, sodium, potassium, magnesium. It would be all of those things inside the vessel. So otherwise, If there's no albumin, then that water is going to move to the outside of the vessel and they become dehydrated. Albumin is protein. So where do you get proteins from? Nutrition, right? You can drink protein drinks and you'll see people with wounds this size that they will need protein drinks because food just won't cut it. If they're diabetic and their blood sugar is out of control, then you have even bigger issues. If you had that wound that Deb did the wound care on, if you had that kind of a wound and you didn't change it often enough and the edges became macerated and the skin broke down, that wound is just going to get bigger and bigger and bigger, especially if the nutrition is not adequate. So when you have patients that have wounds, you have to make sure that their nutrition is adequate. Protein, protein, protein. Yes, they will never have enough. But if they're a dialysis patient, then that protein is important, but it has to be balanced. So that's where your registered dietitian comes in. Okay? Sound good enough? I was going to draw. I decided not to. All right. If you have any questions, documentation. Do you want to talk about documentation?
I can, or you can.
So documentation, you would again talk about the depth of the wound. I mean, or the bed of the wound, what the bed looks like. Is there slough? Is there necrotic tissue? Eschar? Is the wound edges, are they approximating? Is there undermining going on? What's going on with the wound itself? You're gonna, before you put this on, of course, you're gonna rinse that out. You're gonna measure your wound like you did with the wound care that we did. But all of those same kinds of things that you documented, you would also document the amount in the cassette. So the cassette, how many, did you have a cassette that was full? Did you have a cassette that wasn't full? You would still have to document what you found in that cassette or when it was changed last.
I think, are there measurements on?
There are measurements, thank you. So on this particular cassette, you may or may not be able to see, there's a 50, a 100, a 150, and a 300. So that's where you get to measure what's in the cassette. There's a little packet in there that it's for keeping so that bacteria doesn't grow. Also, odor is kept down. So that's what that packet is for, I'm pretty sure. So, I mean, I could be wrong. It could be like turned to gold when you put stuff in it and you have to dig for it, but you know, who knows? All right. So
Date, time, initials.
yeah, so date, time, and initials. So date is 4/13/20. Time is day time. Just kidding. That's probably, it's almost 5 o'clock. And then your initials here. And that will be there so that when someone else comes to change this, they'll know that you did your job. And this has a schedule to when it's changed. So this isn't something you look at and say, oh, do I or don't I? This has a scheduled change. I believe it's a daily change.
In the care plan.
In the care plan.
3 to 5 days sometimes.
Oh, sometimes 3 to 5 days, Deb's saying. Okay. Okay. Yeah? Had enough? Yeah, I bet you've had enough.
Bye.
Bye. Go wash your hands.